Well, welcome back. People throughout the Raleigh community are continuing to mourn the loss of 5 people who lost their lives during the mass shooting in the Hedingham neighborhood nearly 2 weeks ago. Today would have been Mary Marshall's 35th birthday. Mary was shot and killed in that tragic incident.
Mary was the back office manager at Triangle CRC. That's a local chiropractic and rehabilitation facility in Raleigh, and one of our clients here on MyCarolina. Just a few weeks ago, we taped a segment at their office where we got to know the faces who keep the Triangle CRC ship afloat, including Mary.
This is a snapshot from the segment we recorded that day, and before we air the segment that she is a part of next month, we wanted to honor her life here on the show. The Triangle CRC family is mourning her loss, as are her fiance, stepchildren, and other family members and friends.
Mary was a U.S. Navy veteran and a culinary school graduate who grew up in Johnston County. She was set to get married this weekend. Our condolences go out to all of her family, friends, and the Triangle Group.
Triangle Chiropractic and Rehabilitation Center is a one-of-a-kind center of chiropractic, manual rehab, and acupuncture here in North Raleigh. We have with us Dr. Lindsay Mumma back to the show, and Dr. Regis Robinson to tell us about traditional Chinese medicine. Ladies, thank you for being here. Welcome to the show.
Glad to be back, and yes. I'm so excited for you to meet Dr. Regis Robinson.
Yes, well, I was about to say we're welcoming a new face to these segments, so welcome, Dr. Regis Robinson.
Thank you for having me.
Yes, absolutely. Okay, so we're talking about traditional Chinese medicines, but that may be unfamiliar to a lot of people. What is a Chinese medical doctor, and is that different from an acupuncturist?
Okay, so I am a traditional Chinese medical practitioner.
Okay.
Traditional Chinese medical doctor. An acupuncturist can also fall under that umbrella.
Okay.
But as a traditional Chinese medical practitioner, there's acupuncture, there's herbal medicine, there's cupping, there's moxibustion, there's a form of massage called tuina, and there's also exercises called tai chi or qigong. And then you can also incorporate Eastern nutrition. So as a traditional Chinese practitioner, I fall underneath all those umbrellas.
Gotcha.
Now there are acupuncturists that solely practice just acupuncture.
Okay.
And then incorporate a few other modalities. But in my case, and the way it's going these days, most practitioners will fall under the entire scope of Chinese medicine, practicing all those modalities.
Okay, very well-rounded, I'm getting.
Yes, very well-rounded.
Well, I love that. I feel you can definitely feel the sense of just comfort knowing that you're being taken care of in Triangle CRC.
Yes.
Well, I love that. Okay, so if this is probably a very common question that a lot of people ask, but this includes needles.
It does.
Do these needles hurt? How painful is it? And, you know, what can you tell them to ease their minds?
Well, first of all, the needles are pretty small.
Yeah.
And I'm just going to
minuscule.
demonstrate, right? Yeah. Very small needles. Yeah. And most people might feel the insertion, a slight tingling, dull sensation, but it's not an ouch.
Yeah, okay, got it. Yeah. Sometimes
it's more
it's like,
right, it's more of you feel the insertion and then it eases off.
Okay.
Depending on the style of acupuncture, you'll feel the chi, and what that means is an electric sensation. And so there are different types of practices in the way you practice acupuncture. Yeah. I'm a traditional Chinese medical practitioner, and that means sometimes I'd like for the patient to feel the chi, so they'll feel the tingling.
Okay.
But if you are needle sensitive, which we call it, I'll be gentle, and my approach is a little bit more Japanese, which is I insert it in, and you'll barely feel it, but it's doing what it should do.
Interesting. I love that. You have options. If you're a little afraid or intimidated by the process.
And there are different ways I can ease a patient. You know, I'll just tell them to breathe. Yeah. Sometimes I'll talk with them, and once it's in, sometimes the patient doesn't even feel it.
That's awesome. You know? Well, I'm already comforted, and I'm not even getting these treatments right now.
One of the side effects of hanging out with Dr. Regis Robinson. This is nice.
Yeah, I'm totally calm. Okay, so let's talk more about the benefits now. What are patients going to see when they use this form of medicine?
So I've been practicing for over 20 years. And I've seen a scope. People will come in for preventative. So if they know that cold season is coming in, right now we're going into fall, allergies, asthma, any of those immune boosting, people will come in for that. And then I see a range of people from menstrual cycles, fertility, for pain management, for anxiety, stress, insomnia, fibromyalgia, headaches, you name it, people will come in. I will also work hand in hand with other practitioners to make sure that the person's getting the full benefit of the acupuncture and modalities like chiropractic treatment. So yes.
That's amazing. Okay, how does somebody know that they're a good candidate for this type of medicine?
Everyone is a good candidate for this type of medicine. Everyone. Again, what you're doing is you're working with the nervous system, right? And so what you're doing is you're going in, helping release those natural chemicals, whether it's serotonins, endorphins, pain receptors, to help reset the body. And as the body's resetting and doing what it should do, it calms you. And so the needles work and they do what they need to do. And so I think everyone, especially in these days and states, you know, we're all going through various stresses.
All stressed.
And so if you're coming in and you're saying there is nothing wrong, trust me, you'll leave feeling great, and we've done our job.
Okay, so I'm about to go make an appointment right now. How do I do that? How do I learn more information about what you guys offer at Triangle CRC? I didn't even know that this was even available here.
Well, we are an amazing practice.
Oh, I know.
With amazing practitioners. And so all you have to do is look up Triangle CRC, the website, and, you know, Google it, call us. From front desk on, everyone is amazing, so you will be welcomed, and you get to see me.
Of course. I mean, I'm already, that's why I'm signing up. I'm making it, sorry, no offense, Dr. Mumma. Dr. Regis here is getting me to sign up. Okay, so what are these things on the table? Do we need to mention any of these before we let you go?
So I just brought some of these things to show the full, not the full scope, but some of what we do. So here, I'm an herbalist. Sometimes I'll write raw herbs for patients. Sometimes they don't want to drink it, so they're capsules. Or I'll do little pellets that patients can take, or even tinctures. This is a cup for cupping.
I've always wanted to do that. I feel like it really releases muscle tension.
Muscle tension, anxiety. It really releases a lot of pain and emotional stuff. Sometimes people don't realize that using these little things.
Well, a good cry really helps you release all of that, so I imagine pulling that out.
Definitely. So this is an example of cupping. There are different styles of cupping, and this is one that I use.
Gotcha. Okay.
And then we go into a gua sha, which I didn't mention. We are also gua sha practitioners. And with that, this is a fancy gua sha tool. I can use anything from this stone to a bottle top to gua sha a patient. And just similar to cupping, it's releasing stagnation and helping with pain. So I decided to bring that. And then also, too, with gua sha, people tend to, now there's this facial gua sha. You can use this for TMJ. You can use this for sinus infections. You can use this just to really lift up your jawline. So this is an
affordable facial.
Yes, this is.
Yeah, she has an acupuncture facelift is an option for patients.
I do.
And clearly they want to sign up for it because they see her.
Look
They're like,
at her.
I'll take some of this.
Truly, honestly.
So this is a gua sha tool. And then I see children. And sometimes people don't know that acupuncture is good for children.
Yeah, I had no idea.
So I don't necessarily use needles on the children, so I'll just use a probe, and I'll probe the points to get the acupressure points stimulated and get some really great effects.
That is awesome. So many different techniques available at Triangle CRC. Dr. Robertson, Dr. Lindsay Mumma, this is always awesome. What do you point out there? Now I'm curious with everything.
She has all kinds of
things. All these cool tools.
This is a moxa stick, and this is called moxibustion, and this is really good for pain. So menstrual cycles, it's good for pregnancy, it's good for anything pain related, just to move stagnation. And so this is another tool that we use. It's called moxibustion, and the herb is mugwort. And so there are many more things that I incorporate within my practice, but I just kind of wanted to give you guys a taste of some of what you'll get when you come see us.
Yeah, it definitely helps to see it and visualize it and know sort of the techniques that are being used on yourself. So, ladies, this is awesome. If you don't know what these things mean, definitely Google them, call them, beep them if you want to reach them, and sign up for an appointment today. This was awesome. Thank you for being here.
Thank you.
The preceding was sponsored by
It's going to take time. Our community will need patience, will need love, will need care.
My love, my prayers go out to the families, friends, neighbors.
This sort of is our way of letting it all out. This is our way of letting it all out.